So I would say the main philosophy for the practice, or I would say, I guess, the mission statement is integrity. For me, being honest and really communicating what needs to be done, and cutting out all the little extras is the most important thing. I want to know that my patient can trust what I'm doing. And there are many times patients come in and they say, they told me I have, so many things to do. And I look and I say, it's not necessary really right now to do all of that. But just being able to do a quality work in an honest, way, and with integrity is probably the most important thing. I also really value bedside manner. I think with dentistry, patients have a lot of fear when it comes, there's a lot of stigma associated with dentistry. A lot of people come with a baggage where they've had, really bad experience with the dentist, and now they just decide they neglect their dental care, and it's I see it as an environment where I can kind of undo all of that. If I'm giving them proper, bedside manner, proper care, really listen to what they need, it will ease that fear a lot. And, that and technique, making sure, the way I numb them, is a little bit less painful, or kind of the way we go about the treatments, is a little bit easier on them, so that we create that trust, and it will, be a groundwork for a long-term relationship, basically. So, interestingly enough, what I've found to be very helpful is really less talking, or I guess, reprimanding in a way, and more kind of showing them what it is that I am seeing. So let's say with the scanner, we also do photographs. We do a lot of, photography for their teeth, so that we can kind of present it to them, large on a screen. And when people see that scan up close, or when they see the photos, it's talking to them itself. I don't really need to say anything and say, look, this is, the plaque I'm seeing. This is the calculus buildup I'm seeing. It's only been 6 months, and this is, I don't usually see this amount, or this is not common for, to see this amount of tartar buildup. And just by looking at it, it kind of, that bulb goes off in the patient's, head. And then it's really a matter of me giving them tools. Okay, so, what do you use? Do you use a regular toothbrush? Do you use an electric toothbrush? What kind of, toothpaste do you use? What kind of flossing or flossers do you use? And that kind of giving them the tools to be able to kind of empower them to do it themselves, it will automatically encourage them to do more. There are times when we need to kind of decrease the frequency of, or increase, I should say, the frequency of their cleanings. So instead of 6 months, they need to come in every 3 or 4 months. But regardless, I think it really helps to show a patient what it is that I am seeing. So we're looking at things from the same perspective, and then I can point out different things, and it's not really kind of me putting them down in any way. It's more, let's work together to make this happen. Now we're a team. Now we're going to want to kind of figure out how to prevent any issues, and move towards a healthier mouth together, in a way. So.